Good afternoon, everybody. This is Dr. Patmos, and it is March the 10th. And you may notice I have a blue beard today. Well, that's because my wife, who has blue hair, snuck up on me in the dark of night and dyed my beard blue. No, actually, she asked if she could do it, and I said, sure, what the heck. So now you can call me Captain Bluebeard. Anyhow, today's video, I was thinking about Dr. Battacharya and his new appointment running CDC. As you know, he also runs NIH. And I was thinking about how, he testifies before Congress quite a bit. And I've watched a lot of these testimonies and the questions that congressmen and senators ask him. And it's always occurred to me, they don't ask him the right questions. So I thought it would be useful to come up with a list of questions that I would ask him. And maybe, just maybe, some congressman or senator will see this and realize that they've not been asking Dr. Bhattacharya the right questions. So I'm going to do a little role play here, pretend I'm senator, and I have Dr. Bhattacharya in front of me, and I'm going to ask him the following questions. And here's my list of questions, my questioning of Dr. J. Bhattacharya. Dr. Battacharya, you are currently the director of the NIH and also the director of the CDC, two very large federal agencies. You're probably the most powerful physician in the United States. And I think that the public, given your influence, your decisions at these two agencies will impact every single American. You have direct effect on every American's life. So I think, given your incredibly influential and powerful position, the American public would like to know a little bit more about your background. So I have some questions for you. First question is, Dr. Bhattacharya, after you finished your MD at Stanford, did you do an internship? No? Okay. Did you do a residency? No, you said? No, no residency, no internship, no residency. Did you do a fellowship? No, no fellowship. Are you board certified? No, not board certified. Are you board eligible? No. Dr. Bhattacharya, did you ever apply for, have a license to practice medicine? Have you ever had a practice medicine, been a licensed physician? No? Okay. Dr. Bhattacharya, do you know if you even qualify to apply for a medical license, given that you don't have 1 day of postgraduate medical education? You don't qualify. Okay. Dr. Bhattacharya, did you ever hold hospital medical staff privileges or a medical staff membership at a hospital or a clinical facility? No. Have you ever had clinical privileges? No. Dr. Bhattacharya, have you ever managed a single patient after graduating I know you saw patients when you were a medical student and you made rounds with the house staff and you're attending, but have you ever treated or managed a single patient? No. Okay. Dr. Bhattacharya, do you have a degree in epidemiology? No. Your degree is in economics, correct? Yes, that's what your PhD is in. It's in economics. Yes, I understand that. Dr. Bhattacharya, are you a immunologist? No. Infectious disease doctor? No. Microbiologist? No. Do you have any background at all in molecular biology, biochemistry, laboratory research methods? No. Have you ever done bench laboratory research, molecular biology, laboratory research, biochemistry type research? No. Okay. All right, well, let's take a look now at your other research background. Dr. Bhattacharya, looking at your CV, it's prolific. You have a couple of hundred papers. It looks to be that they're pretty much all articles having to do with economics and public policy. Is that correct? Yes, that is correct. I understand that. Okay. Dr. Bhattacharya, you published a paper called the Great Barrington Declaration. That paper made a number of very specific recommendations on how to manage public health during the pandemic. It argued for focused protection. Dr. Bhattacharya, was that paper based on any experimentally substantiated research that's been published in peer-reviewed scientific or medical journals? Dr. Bhattacharya, do you think that papers should have a bibliography? Why doesn't your Great Barrington Declaration have any references? There's not a single reference, no bibliography. Can you explain why that is? Okay. All right, let's turn now and look at your credentials as a management executive. Dr. Bhattacharya, do you have any formal training in management, such as a bachelor's degree in business administration, master's degree in business administration, master's degree in medical management, master's degree in any management discipline, master's degree in operation, doctor of business? No, you have no management education at all. Okay. Dr. Bhattacharya, have you ever served as a C suite executive in a publicly traded for profit corporation? Been a CEO? No. Have you ever been a C suite executive or CEO in a not for profit healthcare organization? No. Dr. Bhattacharya, have you ever run any federal agencies, large federal agencies before? No. You've never been in charge of a large agency like the NIH or the CDC. So then, Dr. Bhattacharya, I have a hard time. I don't understand what your qualifications are. You don't have any clinical qualifications, despite the fact that your bio at the NIH website refers to you as a renowned physician and scientist. How can you be a renowned physician if you don't even have a license to practice medicine and you've never treated a patient? And how can you be a renowned scientist if you don't actually have any training in science or experience doing bench basic science research? And finally, how can you be in essence the CEO of two massive federal agencies when you have no management education or background at all, and you've never managed an organization, been a CEO in any large organization? Can you explain that to me? Dr. Bhattacharya, when you step back and you look at your credentials, it becomes painfully obvious you're not qualified for your jobs.